Ready to talk about hot flashes? Wondering how something that seems so simple can totally derail therapy? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. If you're a therapist, or really anyone trying to help a woman in midlife feel better, here's a question for you. Have you ever known someone who just wasn't getting better, even though the work she's doing is solid? She's anxious, exhausted, not sleeping, snapping at people, foggy headed. And despite your best efforts, she still feels terrible. Before assuming it's just trauma, stress, or resistance, ask about sleep and then ask about night sweats. Vasomotor symptoms, VMS for short, are what we call hot flashes and night sweats. These may sound like just a minor inconvenience, but they are anything but. They affect over 70% of women during the menopause transition. And for some women, especially Black women, they can last 7 to 10 years or even longer. Not weeks, not months, years. And here's the kicker. The symptoms can start before periods stop, well into perimenopause. And they often happen at night when no one's paying attention. That random 2 a.m. wake up might actually be a mild night sweat. Let's nerd out for just a sec. VMS aren't just hormonal, they are neurological. When estrogen levels drop, a group of cells in the brain called candy neurons, that's KNDY and stands for kisspeptin, neurokinin B, and dynorphin, go a little haywire. These neurons help regulate both reproduction and thermoregulation. When estrogen falls, they get overactive and start triggering heat-dumping events. Blood vessels dilate, sweat pours out, and then you're left cold and clammy and confused. This is called a narrowed thermoneutral zone, and it means your body reacts to even tiny temperature changes like it's overheating. So no, it's not just getting older or too many blankets. There's a real mechanism driving this. And when it happens at night, it disrupts sleep architecture and makes everything else worse. VMS are linked to lots of less than ideal outcomes. Mood changes and increased risk of depression, broken sleep and daytime sleepiness, memory issues and cognitive concerns, increased cardiovascular risk, and possibly even brain changes related to Alzheimer's and stroke. For your clients, that means lower resilience, more irritability, and less capacity to engage in therapy, especially for doing deep emotional work. And for you, as the provider, it's incredibly frustrating when your normal approaches just don't seem to land. But here's the good news. Even if someone can't or doesn't want to take hormones, there are solid, accessible treatment options that can help. Let's walk through them. So, what if hormones aren't an option, or your patient doesn't want to use them, or can't find a provider who really knows how to prescribe them safely? Thankfully, there are several non-hormonal treatments that are evidence-based, widely available, and often overlooked. Let's start with the medication options, because while some of these weren't originally designed for menopause, they've shown real benefits for managing hot flashes and night sweats. And in many cases, they pull double duty, helping with mood, anxiety, and sleep all at the same time. First is SSRIs and SNRIs. You probably know these as antidepressant or anti-anxiety medications, but they also help regulate the body's temperature control center in the brain. They basically widen that narrowed thermoneutral zone so the body doesn't overreact to slight changes in temperature. One of the best studied options is paroxetine, or Paxil, especially the low-dose 7.5 milligram version sold as Brisdel. It's actually FDA approved just for hot flashes. Other options like venlafaxine, desvenlafaxine, sertraline, and fluoxetine aren't officially approved for VMS, but many women find them helpful, especially if they're also struggling with irritability, mood swings, or anxiety. What's really cool is that while the mood benefits take 4 to 6 weeks, the improvement in hot flashes often kicks in much faster, sometimes just within a few days. So if your client is dealing with mood and menopause, These medications can make a big impact. Next up is gabapentin, originally used for seizures and nerve pain, but now quietly one of the most helpful tools for VMS, especially night sweats. It's useful for women who wake up drenched in sweat and can't get back to sleep. Gabapentin helps calm those overactive heat signals and often improves sleep as a bonus. Side effects like grogginess or dizziness are possible, especially early on, but at low doses, it's usually well tolerated. If your client says she's waking up every night sweating or with chills, gabapentin might be worth a conversation with her prescriber. Then there's fezolinetant, a newer med and a really exciting one. Unlike the other meds, fezolinetant works directly on those candy neurons we talked about earlier. It blocks neurokinin B receptors, which are involved in triggering hot flashes. This is a non-hormonal FDA-approved medication developed specifically for vasomotor symptoms. It doesn't affect mood, sleep, or anxiety directly, but if hot flashes are the main complaint, fezolinetant is designed to target that root cause. Access and insurance coverage are still a little spotty, but it's a great option to know about. Then there's clonidine and oxybutynin. Now, these two are less commonly used, but still worth mentioning. Clonidine is a blood pressure medication that can also reduce hot flashes, particularly in women who already run a little hypertensive. The downside, it can sometimes lower blood pressure too much and cause dizziness, which isn't ideal, especially as we age. And then there's oxybutynin, a bladder medication that reduces sweating by blocking certain nerve signals. It's kind of a side doorway to calm hot flashes. If your client also struggles with urinary urgency or leakage, this might be a good 2-for-1 option. But it does have anticholinergic effects, so it's best to be cautious in older adults. Now, if your client isn't ready for medication or wants something to go with it, there are some really effective behavioral strategies too. And this is where therapists can really shine. Let's talk about CBT, or cognitive behavioral therapy, specifically for menopause symptoms. CBT for hot flashes is a structured, skills-based approach that teaches women how to respond differently to the symptoms, physically, mentally, and emotionally. And it doesn't make the hot flashes go away, but it changes the brain's interpretation of them. Women report fewer hot flashes, lower intensity, and much less distress. It can also help with sleep, anxiety, and emotional regulation, which, as you know, can really spiral during perimenopause. If you're a therapist, this is a powerful tool to have in your back pocket. And if you're not trained in CBT yourself, consider a referral to someone who is, or to a group program or online course with a menopause focus. Beyond CBT, there are other supportive strategies worth knowing. Clinical hypnosis has a surprising amount of evidence for VMS. Mindfulness, paced breathing, and relaxation techniques can help calm the nervous system and widen that thermoneutral zone. And of course, lifestyle adjustments matter too. Cooling pillows, layered clothes, avoiding alcohol or spicy foods, and keeping a consistent bedtime routine all help reduce triggers and support better sleep. These aren't quick fixes, but for the right person, they can make a meaningful difference, especially when used alongside medical treatment. If your client is feeling stuck without gains from therapy, don't forget to zoom out. Ask about sleep. Ask about night sweats. Ask whether their symptoms fluctuate through the month or have gotten worse in their 40s or 50s. You might be the first person to bring it up, and it could be the missing piece of her puzzle. CBT can help. Meds can help. Referrals can help. And sometimes just naming what's happening makes all the difference. I hope your brain is full of sweat-free sleep. No middle-of-the-night pajama changes required. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!